Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Dr. Kerry D'Ambrogio, a physical therapist, osteopath, and board-certified acupuncturist. He's author of Positional Release Therapy by Mosby and has numerous articles in industry publications. Kerry began his career in 1988 and is founder of the D'Ambrogio Institute, teaching orthopedic and energetic manual therapy to empower informed treatment decisions. He's an international lecturer and certified instructor recognized by the Upledger Institute, Barral Institute, and International Alliance of Healthcare Educators. Let's listen and learn as Dr. Kerry reveals the role of lymphatic balancing for the cervical spine in promoting healing and reducing congestion. He'll review lymphatic anatomy, key principles, and treatment options for orthopedic patients. Dr. Kerry will demonstrate techniques and introduce an active lymphatic pumping exercise to support fluid movement, enhance tissue repair, and improve function. Again, thank you everyone for joining us today. And again, feel free to chat questions and comments that Dr. Kerry will answer at the end. And with that, Kerry, welcome. And I know you have a lot to get to, so I will exit and come back on to help you with chats. It's all
All right.
yours.
Thanks, Donnell. And I just want to thank EduTalk series and Biotome for having me again. I like doing these talks. They're quick, and I think as a student, you can hear a variety of different teachers talk about their expertise. All of you are going to get something out of today. This lymphatic technique is something I use every day in my office. And you're going to see that, if you're treating people who have had car accidents, sports injuries, sprain, strain injuries, a lot of times we use our manual therapy to remove barriers because in order for something to heal, a tissue to heal, it needs blood supply. Blood carries oxygen and nutrition. But if you have an area that, there's muscle spasm, there's scar tissue, fascial tension, joint hypomobility, you need to do those manual therapies first. But then why do we do lymphatics? There's an old saying in osteopathy that drainage precedes supply. In order for those tissues to get the oxygen and nutrition, you got to get rid of the toxicity. So a lot of times I do a lot of manual therapy, but at the end of my treatment, I'm usually finishing off with either manual lymphatic drainage or I teach exercises. I'm going to teach you exercises at the end, and they work extremely well. Let me go to here. So this is what I'm going to talk about today. I'm going to talk about, well, what is lymphatic balancing for those that don't know it? Why is it so important to know? When do I use it? Like a lot of times we learn different techniques, but it's important for you to know, well, when do I use this technique? That's always an idea with myself. I learned so many, I got hundreds of different techniques and you can learn them, but the key thing is when do I use it, right? Which is the most important one? I'm going to talk about my foundational experience, relevant lymphatic anatomy for this area, and then I'll get into principles. These would be principles of how we treat it. I'm going to talk a little bit about doing manual work as well as the exercises. All right. So what is lymphatic balancing? Well, it's a manual therapy technique, and we use it to relieve both specific, by specific I mean in a local area, like your neck or your knee, elbow, versus more systemic congestion in the body. So we can do either or, okay? When we do this lymphatic balancing, we are removing sort of waste products, edema from the soft tissues. That's one aspect. But we're also removing it from effusion in the cavities in the joints. So we do soft tissues, we do cavities, and we do joints. And when we do this, it's going to help when we take away a lot of these metabolites, we're going to decrease pain. And that's one of the side effects with it. If someone has a toothache or a headache, a lot of times by doing it in this area, you can release those rather quickly. When we release and we get rid of a lot of this excess fluid, you're going to restore full range of motion, especially if that area is congested. That's something you'll see right away. Now, one of the key things this technique does is it's going to allow for optimal tissue healing. Just like I said, we have 4 types of tissues, right? We have muscle tissue, nerve tissue, we have endothelial tissue, which is like on your skin or the lining of your blood vessels or cavities. And we have connective tissue. All those tissues have cells. Each one of those cells needs oxygen and nutrition. So the blood has to go down the arteries, arterioles, capillaries, etc. It's got to bring the oxygen and nutrition to the cells. Each cell is going to give off waste products, right? And we got to take that away. We take it away through the venous system, but also the lymphatic system. Drainage precedes supply. When we do that, the tissues, the cells get what they need, and we get optimal tissue healing. Now, my background is I learned lymphedema, lymphatic drainage from a variety of sources like Vodder, Chickley. Chickley was a medical doctor, Vodder's more massage. Leduc was a physical therapist. A good friend of mine, David Doublestein, he also wrote a book on this. And so I've learned all these sort of the anatomy and sort of how you approach lymphedema. But I wasn't interested in treating lymphedema. I wanted to apply it to the orthopedic patient. So then I started to use my background as an osteopath. And at osteopathic school, we learned a lot of lymphatic pumping techniques. So I've added those to this curriculum. And the whole thing is my focus is the orthopedic injuries. Okay? I think this is a technique you can do at the end of almost every treatment, especially if you're treating people who've had car accidents, sports injuries, sprain, strain, type injuries, low back pain, all sorts of things like that. Now, why is lymphatic balancing so important? Well, we kind of talked about that. We talked about there's 4 types of tissues. Tissues are made up of cells. Every cell in the body needs oxygen and nutrition. So there's blood flow that's coming towards from arteries, arterioles, into the capillaries, supplying each cell with oxygen and nutrition. But in order for those cells to get it, you got to get rid of the toxicity. So we have venous return, right? Now, if 30 liters were to leak out at the arterial end, about 27 liters comes out through the venous end. So we lose about 3 liters. Therefore, the lymphatic system is a secondary system which brings fluid, right, blood, back to the heart. So if you take a look at this diagram on the left, the lymphatics are in green. It's a secondary system. You can see the venous system, that's a closed loop system with the arterial. The lymphatics is a secondary system, and it dumps the fluid back into the venous circulation and to the heart, right? Now, if you notice, there's little lymph nodes along the way. These are areas where the fluid is cleaned out. Now, why does it all come back to the heart? Well, when it's in the heart does what? It sends it to the lungs. The lungs are a place that we can get rid of toxicity through our breath. We can also take in oxygen. And then it's going to come down here to the liver. The liver takes in this toxicity, breaks it down, actually converts it into bile. So when we have a fatty meal, we get rid of it through our bowel movement. So we get rid of toxicity through our breath, through bowel movements, and then it goes down to the kidneys. The kidneys filter it out and we urinate it out. So we breathe it out, we urinate it out, we use our bowel movements to get it out. We also sweat it out. Those are our areas that we can get rid of things. Now, what happens if someone is not exercising, is not moving their body? Let's say they're sitting a lot. Well, we tend to store a lot of this toxicity. And where do we store it? It's interesting. We tend to store it inside bones. Bones are hollow. We tend to store them inside joints. Okay? And so what you'll see in some of the slides I'm going to show you is, you could have someone that comes in and they have a pain, but it's insidious onset. There was no sports injury. There was no, mechanism of injury. They just have a pain. And a lot of times that can be a buildup of toxicity. I talked about that in my systemic lymphatic balancing class that I did for the EduTalk series. You might want to watch that as well as this. All right. Now, when do you use this technique? This technique here, let's give an example. Let's say we have two people, and let's say they're both complaining of headaches and neck pain. So what are the questions we all face as practitioners? One of the questions is, where do we treat, right? Are we going to treat this neck, right? Are we going to treat the head, or are we going to treat somewhere else? Now, when you start to understand lymphatics, lymphatics are going to drain from a high pressure to a low pressure. And when you talk about, let's say, the head and neck, all of this has to drain down to the heart. So if you have swelling, let's say, in the neck, or, I've had people with hydrocephalus, swelling inside the head, you don't start there, right? Because it all has to go here to the chest. If your diaphragms are restricted, your ribs are restricted, there's a lot of tension in this area, that means it's a high pressure. It has no place to drain. So a lot of times we're programmed to treat where the patient feels it, but that may not be the best place. So you're going to see with this technique that there is a pathway of drainage. And you almost have to work, let's say, from the heart, that's where everything goes to, and you have to work your way back towards the area you're going to treat, and then you work from there back to the heart. So you're going to see that as a theme, okay? The next thing we talk about is, once you decide where it is you're going to treat, what are you going to treat? We have lots of anatomy. What can affect the flow of lymph? Well, protect the muscle spasm, fascial tension, joint hypermobility. So we have to have a way to decide what exactly is it we're going to treat. And once we decide that, do you have the necessary tools to get the job done? And that's what our focus is at the D'Ambrogio Institute. We ask a lot of questions. We teach a lot of evaluations. It's the evaluations that help determine what it is you're going to treat. Okay, so we answer those questions that way. Now, this is our philosophy. It's very simple, right? We evaluate. Why do we evaluate? We evaluate not so much to diagnose, but to measure change and know where to begin. What things do we need to work with first? And that's going to help us determine what our treatment's going to be. And then what do we do after that? We reevaluate. Why do we reevaluate? See if it worked. So all my courses are based on this simple philosophy. Evaluate. From the evaluation, determine, do we treat specifically or systemically? And then what are we going to treat? And then once we do that, we reevaluate. We learn from that. Was I correct in my decision making? Or do I have to make tweaks to it? So this is something that's important for that. You have a copy of this. Danelle's going to give you guys a bunch of handouts. This is one of them. You guys are going to get a study guide that follows this along. And you're also going to get this chart as well. This is how I base a lot of my decision making. So I use a total body screening examination. And you're going to get this as well. This is the total body screening examination. And these are the things that I evaluate. So I can look at posture. So I can look at the base of the skull. So why do I look at the base of the skull? Well, if you look at the bottom, there are holes in the bottom, and this is where the jugular foramina. So the vagus nerve comes out there, which is a parasympathetic nerve. So one of the things I do is I evaluate that suboccipital ridge. Structure affects function. If it's out of place, there also could be tension there. We do that in other evaluations. But if that's restricted, that affects the flow of the vagus nerve. We also take a look at the shoulders. We call that the upper T-line. If the upper T-line is not level, why isn't it level? It's usually due to fascial tension coming in from the head and neck or one of the arms. We also evaluate down the spine from T1 to L2. That's where your sympathetic chain is. So we feel the spinous process. We go laterally about 1/2 inch. And what we do is we run our fingers down. And what we're looking for is asymmetry. We're looking for rotation. Structure affects function. At each level, you're going to have nerves that are going to come out, and there's a sympathetic chain there. Okay. Now, why is this so important? Because this autonomic nervous system affects the smooth muscle of your lymph vessels. your arteries and veins. And if you're on sympathetic overload, you're going to get vasoconstriction. So these are important things to measure. Then we look at the lower T line, which is the pelvis. If that's unlevel, it usually means there's fascial tension coming up in one of the legs. And then finally, we look at the sacrum, right? We want to see now the sacrum, we usually feel the sacral base. If this is unlevel, this could affect the nerves that come out, and S2, 3, and 4 are the ones that are also parasympathetic. So if you've ever heard of craniosacral therapy, cranium is parasympathetic, sacrum is parasympathetic, and then from T1 to L2 is sympathetic. So in this evaluation, we do a quick evaluation, the suboccipital, upper T line, down the spine, lower T line, sacrum. From here, we get a great evaluation of the autonomic nervous system, as well as the fascial system of the extremities. Okay, and then we move on to lines of tension. We're going to check out lines of tension in the legs, the arms, and the head and neck. Why do we do that? Because we have fascia that wraps around the muscles and the bones in your arms and legs. That's called appendicular fascia. And that fascia blends in with the fascia of your torso. It also blends in with your visceral fascia and the meningeal fascia of the brain and spinal cord. So it's all interconnected. If this fascia is restricted because of surgery, sports injuries, car accidents, falls, things like that, remember that fascial restrictions or protective muscle spasms, joint restrictions, that's going to affect the flow, right? That affects physiology, right? And that's how the body heals. So these are extremely important. We also, in cavities, we look at the transverse diaphragms. We place our hands on them and we glide to the left and to the right. It should move equally in both directions. We talked about this in the systemic class I did. Now, why are the diaphragms so important? Because they're horizontal in nature. All our vital structures run vertical. Nerves, arteries, veins, lymphatics, also the acupuncture meridians. So these are extremely important. And we also take a look at the chest and the abdomen. Why? Because this is where the circulation is. This is a diagram here of your lymph drainage through the abdomen, and it all comes back to the heart. So by doing this evaluation, we can see very clearly whether you are a total body patient, systemic, or you're more specific, and whether you're orthopedic or you're lymphatic. Okay? So here's our two people again. They come in for treatment. They both want you to treat their head and neck, right? But where, we need to answer our questions. Where do we treat? What do we treat? Okay. So when we look at this, when we do the total body screening examination, this will help us decide whether it's systemic or specific. This is actually a patient of mine. She was from Montreal. She was in a horrific car accident about 10 years ago. She kind of filleted her left foot. She had, I think, 4 operations. So when she came into my office, I did an evaluation on her, and her main complaint was head and neck. So, and what did she do? She went to chiropractic, she went to physical therapist, acupuncture, massage, and what do you think they all did? They all focused on her head and neck, right? So when we evaluated her, we could see that her left leg was involved, left arm, all the diaphragms were restricted. There's restriction up in the head, and all the alignments, right? The postural alignments were off. So her autonomic nervous system was affected. So that's going to cause vasoconstriction. So with her, all that fascial tension from that left foot was pulling all the way up into the head. Think of your head and neck as a penthouse of a building. Think of everything else as all the structure in the floor below. If everything is restricted below, it's going to affect that area. Let's go over here to the vibe board for a sec. So remember that all of her restrictions were here and here, coming into here, and her diaphragms were affected. So what I did is I had her lying down on her back with her legs straight and her arms by her side. When I tried to lift her head and neck, I couldn't do it. It had all this fascial tension in it, right? All of this was pulling up to that head and neck. But when I got her to bend, right, this left knee, right leg straight, and I got her to bend, right, this left elbow. And also, if you see that she likes to turn her head this way, I was able to lift her head up and move her very easily because we reduced the tension in that leg. So I told her that the reason why she was having that problem and continued to have it was not because of tension in her neck, but it was fascial tension coming up, probably from those 4 surgeries she had in her left foot and ankle, and also tension in her left arm. So we could quickly see within a few seconds from this evaluation where her problem is. So we did a systemic treatment and we released lines of tension in her legs or arms. We opened up the transverse diaphragms. We were able to release the headache and neck pain in 2 visits. She was in tears. She goes, I couldn't believe it. She's still a patient of mine. She still comes in when she comes in, because I live in Florida, she comes in, a couple times. When she comes down for a couple of months, she'll come in for, a few treatments just for tune-ups. So she was a systemic patient. And we do a systemic evaluation. I don't have time to go through that, but we do a systemic evaluation so we can measure the level of severity, but also tell whether it's orthopedic or lymphatic. So the treatment can be systemic orthopedic, right? That's usually due to these lines of fascial tension, the transverse diaphragms, all that's more fascial. We could also have systemic lymphatic, and this is where you have total body congestion. I talked about that in the previous lecture. I have systemic energetic balancing. So I have a energetic manual therapy program as well. So we work with people energetically because everything is made up of energy, in our bodies. Now, how do we know we were correct with this? Because again, doing this on hundreds and hundreds, thousands of patients over and over. And what did I do? I evaluate, I treat, and I reevaluate. So when we do the reevaluation, we can determine, did we make the right choice? Is the patient better, basically? Now, let's look at that other patient. That other patient was complaining of headaches and neck pain. Now, when we did his evaluation, you can see that his is more localized to that head and neck. So we would call him more specific to that area, okay? And when we evaluated him in more detail, it was actually more muscular, right? And a little bit of joint, but that levator scapula was affecting it. I think he's 6'4". He's an accountant. His ergonomics were terrible. He's working off a laptop. So he was a problem there, okay? So he was a specific approach. Then we do a specific evaluation. We call that ARTS, A-R-T-S. Now, A stands for asymmetry. So we place our hands on the bony landmarks of the neck to see if there's any rotations, okay? Usually it should be symmetrical. If there's rotations there, why is it rotated? Is it joint? Is it fascia? Is it protective muscle spasm? R stands for range of motion. What are the movements of the neck? Movements of the neck are, flexion, extension, right? Rotation, and side bending. Those are lower cervical movements. We can also do upper cervical, which is like a chin to the Adam's apple, looking up, ear to the side of the neck. So we can evaluate having the patient do it actively, but then I can palpate and do it passively. Why do I want to do it passively? Because I want to feel the end feel. The end feel is what I feel at the end of available range. If it feels like an abrupt stop, it's really hard, that tells me it's a joint problem. If it's more firm, like an elasticity to it, that could be more fascial or protective muscle spasm. If I feel it's a soft end feel, kind of boggy, tells me it's swelling. So the body leaves clues. So that was the R. The T stands for 4 things. T stands for tissue tenderness, because I'm trying to find out, what do I treat? So I could palpate this area. I know that the person has asymmetry. I know that there's compromised range of motion, but now I need to palpate the tissues. Is there any tenderness? I use a scale from 0 to 10. 0 is no tenderness. 10 is, the worst amount you'd have. And is it tender? Is there protective muscle spasm? Typically, if someone has protective muscle spasm, they're going to have a firm end feel, kind of an elastic end feel. T can also stand for tissue glide, where I place my hand on the tissues, the fascia, and I can glide and feel if there's any fascial restrictions. This also has a firm end feel, okay? T stands for tension test. I can take the neck and glide it left and right and feel, right, the available end range of motion. Does it have a hard end feel? Is it rigid? Is it stuck? This tells me more joint stiffness, right? Joint hypomobility. T can also stand for tissue texture changes. This is where I start to feel the tissues, and you can feel the bogginess in it. You can feel the swelling in it. Sometimes there can be a temperature change, okay? Now, S stands for special tests. Special tests can be a limb weight test where you can lift a leg or an arm or the head. If it feels heavy, right, it usually indicates congestion, right? Heaviness, swelling. I can also do a nodal evaluation. All of this drains down here to the clavicles. So I can palpate along the clavicle, supraclavicular area, see if there's fullness in that area. If I was working on an arm, if an arm was heavy, I would check the axilla nodes. Does it feel heavy there? So you're like a lawyer, you're building a case. Is this really swelling? If it's the legs, they're going to drain into your inguinal nodes, right?
What?
So now, once we have, we know it's a specific approach, we know that we're going to do a specific treatment, we have choices. How do I know something needs muscle balancing? Well, they're going to have asymmetry. They're going to have decreased range of motion. They're going to have a firm end feel. But the key finding is tenderness, right? They're going to have protective muscle spasm. How do I know someone has fascial problems in the neck? They're going to have asymmetry. They're going to have decreased range of motion. The key finding is the tissue glide test, right? It moves easy one way, but stuck another way, okay? And they're going to have a firm end feel. How do I know it's a joint problem? They're going to have asymmetry, decreased range of motion, typically a hard end feel. And the key finding is going to be the tension test. The body leaves clues, right? Evaluation tells you what to treat. So in this class is about lymphatics. How do I know lymphatics is the key thing? Well, when I evaluate the neck, there's going to be asymmetry. There's going to be decreased range of motion. But when I evaluate, it's more of a soft, boggy end feel. The head is going to be heavier, probably fullness in the proximal nodes. But the key finding is going to be feeling the muscles of the neck and feeling a sense of fullness. Especially if they have swelling on one side versus the other, you will feel that fullness. When I teach these classes live, I always have people lie down and people come up and feel it. And you can feel the fullness in the tissues. Now, if something is more energetic, we have a biofeedback test that we use on the patient to find out, where the problem is and how we deal with that. Now, how do we know we're right with this? We reevaluate after the treatment, right? And we can find out whether this evaluation I'm teaching you works. So this has been done thousands of times. It works because we evaluate. The evaluation tells us what to do. We do it, we reevaluate, and we see the changes. Okay? So this gives you a good visual here. Two people, they both have headaches and neck pain. And you can see that one is specific, meaning we have to treat more local. One is systemic. We have to be more global, like the lady who had a 10-year history of neck pain. She had 10 years of people just treating locally, specifically, didn't do anything. Once we started to bring her legs into the formula, her left arm, left leg, open up the diaphragms, that's where she started to see the change. So that's critical, okay? Now, you're going to get this in your handout as well. There's a QR code. This is my gift to you. There's a 1 hour, I think a little over an hour video, and all of this is evaluation. Okay, this is going to teach you how to do that total body screen examination. And I've also, Danelle is going to send you the total body screen examination intake form. So you can keep that. You can photocopy that, use this, but I would watch this video. It's going to teach you how to do that. Now, what's my foundational experience? Well, I went to school to play football. I was going to be a professional football player. I was a linebacker. And of course, I got injured. And I went to the therapy clinics and they would treat me with all sorts of, massage, ultrasound, e-stim, things like that, exercise. And those treatments did work, but I would always be nagged by things. They would keep coming back again. I got so frustrated that I could see my days as a football player were numbered. So I got interested in being an athletic trainer. And so I was the athletic trainer for the hockey team, learned a bunch there, but I wanted more. So I went to physical therapy school and I met one of my first mentors, Doug Freer. He was my teacher. I ended up working for him eventually. But he started to introduce to me osteopathy, muscle energy, myofascial, cranial sacral, strain counter strain, all of these things. And I'd be writing them down in class. And I took all those classes while I was a student because there's big discounts. And it was interesting that every time I took a class, we work on each other, my body was getting better and better gradually. So it wasn't one thing, it was an integration of many things. So I learned lots of techniques. And I remember when I opened my clinic, a lady came in with low back pain and I didn't know what to do. I had too many techniques. I was confused. They never tell you when to use this technique or when to use that technique. I didn't have the evaluation. So I ended up going back to osteopathic school. In osteopathic school, they taught me great lessons, is that it's all about principles. It's about understanding anatomy and physiology. It's understanding that the role of manual therapy is to create a better environment through releasing muscles and fascia and joint to create a better environment for physiology. That person you're treating can heal themselves. And the lymphatic drainage precedes supply. Once you do your manual therapy, then you do the lymphatic drainage, you get rid of the toxicity, get rid of the fullness. And when you do that, you create space so you can get blood supply with oxygen nutrition so the body can heal. So I learned that. And then I started to apply that, over the years. So my background, is athletic therapy, physical therapy. I'm also a doctor of oriental medicine and an osteopath. Okay. Now, some lymphatic anatomy. We talked about this already, how the heart sends blood through the arteries to the arterioles to the capillaries so that every cell in the body gets oxygen nutrition. They give off waste products. Now, if there's waste products there already, we got to get rid of them, right? We get rid of them through the venous system, right? And remember, that comes all the way back to the heart, then the lungs, then the liver, the kidneys. We talked about that. And also, we mentioned that if there was 30 liters there, 27 liters will come back through the venous system, and we have to get rid of the other three. The other three is through the lymphatic system. So the lymphatic system is a secondary system to get fluid away from that area. It all comes back to the chest. That's important to know, okay? Now, in lymphatic anatomy, we have different zones. So if you feel along your clavicle, everything above that is zone 1, right? The head and neck. Between the clavicle and let's say if you feel your belly button, draw a line there, front and back. That's zone 2. That's your breast and your abdomen, your arms, your thoracic. That's all going to drain into your armpits. Everything below your belly button, right? That's zone 3. So your lower abdomen, your external genitalia, your legs, your lumbar spine, sacrum, pelvis, all drains into the inguinal area. These are all key drainage zones, okay? So this is important to know these different zones, okay? Now, here's the important thing is each of these zones are going to drain to a lymph node, and which will get back to the heart. The key thing I want to show you here is that there's your skin. So if you feel your skin and then sink down to muscle, right? You're between skin and muscle is this upper collector area, right? These are all collector vessels. If we go below that, then we're in to the lymphatic collectors for muscles and bones and things like that. So there's actually 2 collector channels, a superficial and a deep, throughout all these different zones. And it's all going towards lymph nodes. The flow of these collectors, right, flows from the head and neck, all flows to the lymph nodes here around the clavicle. Everything in your chest, abdomen, arms, thoracic goes to your axillas. Everything in your lower abdomen, your pelvis, lumbar spine, external genitalia, legs, goes into your inguinal, okay? Now, this is a beautiful shot. When you look here, you can see that there's lymph vessels in green. Look how they're found deep inside a muscle. This is why, when I'm going to show you the exercises later, why we want to do muscle pumps. Because most people do lymphatic drainage very superficially. we're doing it more orthopedically. We need to get these muscles pumping to drain it. You can see here, remember we talked about how we can store toxicity in bones? Bones are hollow. A lot of lymph can be stuck in here. So we need to move the muscles, we need to move the bones. It's going to help to move the fluid along. It's also found in joints. And this is a cool picture here. It's also found in nerves. So you want to drain this to help to decrease pain. We already talked about that. Okay. So feel your clavicle. Divide your body in two. Everything on the left goes left, everything on the right goes right, and this all drains into the supraclavicular area. Where does that go? Right? So these collectors all drain. They're all going towards what? They're going towards a trunk. So your neck and your face are all draining towards your jugulars. Remember, we have jugular veins here. So we have a left and right jugular trunk. What do they drain into? They drain into ducts. On the right side, we have a right lymphatic duct. On the left side, we have the thoracic duct. Where do they go from there? Well, they go into the subclavian vein. Remember, everything goes back to the veins. Where does that go to? Superior vena cava. And then to the heart. That's the flow. So you need to know what is the pathway. If you know the pathway, then you're going to know how to treat it. How about the axilla? Right? Everything on the left drains left. Everything on the right drains right. They all go into the axilla, between the clavicle and the umbilicus, front and back. So that's going to drain right here into the right subclavian trunk. So these collectors drain in there. And where does that drain into? The right lymphatic duct on the right side, the thoracic duct on the left. What does that drain into? Subclavian veins, right? And where's all that? Right around the clavicle. That's why this thoracic inlet is so important. Where does that drain to? Superior vena cava. Where does that drain to? The heart. Okay. Now, if we go down to zone 3, right, your lower abdomen, lumbar spine, pelvis, sacrum, legs, external genitalia, it all drains into the inguinal nodes. Where does that go? Goes deep inside the body. Remember, we showed you this picture before. We have the left and right lumbar trunk, right? But we also have a bunch of organs in the abdomen, the intestinal trunk, and they all drain into, right, this thoracic duct. Where does that go to? It's going to go to the subclavian vein on the left. And where does that go to? Goes to the heart. Okay? So it all follows that pattern. And then here we have the sort of the thoracic cavity, right? Where your lungs are, your heart, etc. Well, where does that drain to? Drains into the right and left bronchiomediastinal. Where does that drain to? Right lymphatic duct, thoracic duct. What does that drain into? Subclavian vein, superior vena cava, right? Heart. It all follows that pattern. So now we're into principles. You need to know your lymphatic anatomy. I wanted to go over it so that you had an overall understanding. So you need to know your lymphatic anatomy. You need to understand, for this class, the drainage pattern of the thoracic cavity, because everything goes there, and zone 1, which is the head and neck, right? So that's our focus right there. So we understand that all the collectors from your face, your neck, are all going to drain into the left and right jugular trunk, into the right lymphatic duct on the right side, the thoracic duct on the left, okay? And then subclavian veins, right and left side, superior vena cava, and the heart. That's the drainage. So when we treat that, we need to understand that we work our way backwards. You need to understand the lymph flow dynamics. So what does that mean? You need to understand that everything moves from a high to a low pressure. Everything has to move back to the heart. There is something called Boyle's Law. And what I want everybody to do is everybody take a deep breath in. When you breathe in, you should feel your chest expand anterior and it expands laterally. When you breathe in, your respiratory diaphragm descends. This all comes up. So what's happening when you breathe in? Your volume is increasing. When your volume increases, the pressure decreases. Remember I said lymph flows from a high pressure to a low pressure. So if you had swelling, let's say in your hand or your elbow, you don't start there. You need to know what's the pathway and you work your way back. It's all going to go to the heart. So we're always opening up this thoracic cavity first. Okay? So when we look in here, We want to have good rib mobility. We're going to have good diaphragm mobility. And we understand that everything has to come back to the thoracic cavity. It's so important. Okay. We have to apply the treatment flow principles. What does that mean? We work proximally first, right? And we go proximal to distal and then distal proximal. So what does that mean? Well, when I'm treating this area, I don't start here. Where does it all go to? It goes to the heart. So I need to do something to open up this chest. And then there's a whole bunch of things going on in here, the ducts, right? And the trunks. So I need to do something in this area to get this moving, right? And then I need to work here and then go to the face and then work my way back. We can do that manually, and we can also do it through exercise. So in the last video I showed you, I taught you about systemic lymphatic balancing, how we have to make sure that the diaphragms are open, the rib cage is open, and as the rib is opening, we get the Boyle's law, right? Increase volume, decrease pressure, so things will naturally flow back. So that's where I start with systemic. And then we evaluate lines of tension in the legs, the arms, and the head and neck. We have to free that up because if you have any type of protective muscle spasm, fascial tension, joint restrictions, that can affect the flow of lymph. So we need to do that. Also, the autonomic nervous system, right? So we know about the vagus nerve up in here coming out the jugular foramina. We know about the parasympathetic S234. We know sympathetic is T1 down to L2. So why is this important? We need to modulate the autonomic nervous system because it directly affects the smooth muscle of your blood vessels and your lymph vessels. So that's the third thing we do. And then we work the lymph nodes, right? All on the clavicle and the anterior neck, the axillas, and the inguinal. We work those areas. And that's what we taught you. We talked about that in the systemic class. So why am I mentioning that in this class? Because you need, if it's present, it's all evaluation. If you see it there, you need to do that first, right? This is what I'm going to show you now is not going to work unless you've done the other stuff. And in that systemic class, I showed you systemic exercises. So you should watch it if you haven't seen it yet. Okay. So here is specific work. So is it on your left side? Is it on your right side? So we know that that is going to drain into the jugular trunk, right? Which is going to drain into the ducts, right? We know that. And it's going to drain into the subclavian veins, superior vena cava to the heart. So we can work in reverse order manually, but we can also do it through exercise. So now we're going to do some exercise. So when I show you these, what I want you to do is do them. You know, it's not good for you just to watch. I would do them. There are not too many of them. It's pretty quick. So what we want to do is we want to start with the thoracic cavity. So why do we want to do that? Because everything's going to flow down to the heart, right? We know that, okay? So there's three exercises that we want to do, okay? The first one is a spinal roll down. So I'll show you this. This next exercise is kind of a spinal roll down and it's coming back up. And she's going to tuck her chin in like this. And I want you to see what happens. See the pressure we're getting in on the sternum and up here. And then we also get the abdomen involved. And then you're going to come back up like this, nice and rhythmic. So it's getting a lot of the deep drainage in the chest, the sternum. It's also getting the clavicles. It's also getting the deep neck flexors. I like this exercise because it also gets a lot of the deep drainage in the abdomen. So it's a nice pumping exercise. You're going to come all the way down like this. Good. Come all the way down. Make everything a bit tight. 1, 2, 3, and then come back up. Perfect, like that. Okay. So that's the first thing you do. You slump forwards, 1, 2, 3. And I like to come up and actually extend back. So you want to do it rhythmically. You don't want to do it too fast. Then the next thing we want to do is an anterior arm lift pump. What this is going to do is open up the rest of that anterior rib cage. Okay, this next exercise is an anterior arm lift with respiration. So I'm going to have your thumb straight up like that. You're going to breathe in and lift your arms over your head and stretch. 1, 2, 3. And relax. 2, 3. Watch what happens to her chest as she lifts. It's a rib raise. So it's opening up the ribs. It's stretching the sternum. Come on down. It's also stretching her respiratory diaphragm. Good. Also down in here. So it's a nice anterior exercise. Opens things up, gets the ribs moving, diaphragms moving. It affects the sternocleidomastoid here. Definitely it affects the, when you lift your arms up, again, you can see the clavicles moving. Good. And one more. That looks good. And breathe in and a nice stretch. Perfect. And relax. Okay, and then the next area we want to do is we want to do a shoulder roll. Because remember all those structures that are in this particular area, where the ducts are, right? This next exercise is sort of a posterior shoulder roll. I like it because it gets this whole area moving. All this thoracic inlet where the clavicles are, the ribs 1 and 2. So what you're going to do is you're going to lift your shoulders up, squeeze them together at the back. Good, nice big roll. Come up. 1, 2, 3, and then don't forget to pause. Good, and back up. There, and then relax. Good, and then come back up. And relax. Good, again. Back. We'll do one more. That looks good. And back up. Nice motion there. So we get some motion in the scapula there, in through here. This whole area is working really nicely. Okay. Now we get up into the neck and the cranial. Okay. So the exercise, so all in through the front of the neck, the lymph nodes, if you feel your clavicle, you have lymph nodes all the way along here. We got those already doing this. But if you feel your sternocleidomastoid, we have lymph nodes anterior behind this muscle and lateral behind this muscle. So we're going to be doing flexion extension. Think of lymph nodes as like a sponge filled with fluid. We're squeezing it, 1, 2, 3, and we're coming out of it, 2, 3. Let's say your patient has swelling in the anterior cervical region, or they may have a lot of swelling in this area. You want to create some movement. So you're going to tuck your chin in, and I want you to contract these muscles, create a pump, 1, 2, 3, and then just let it go. Chin to your chest, squeeze the front of your neck. Remember, we have a lot of the deep cervical nodes there. So again, come down, squeeze, 1, 2, 3, and relax. 2 more. Let me come in, 1, 2, 3, and relax. Come back one more time, 1, 2, 3. And relax. Perfect. Okay, and then we want to get up a little bit higher so we can do a upper cervical flexion pump. Okay, if your patient has swelling in more of the upper cervical spine, we can do a little bit of upper cervical flexion. Just tuck your chin in and bring it down to here. Good, perfect. 1, 2, 3, and then relax. 2, 3. Bring it down again. Excellent. 1, 2, 3, and then relax. 2, 3. Down again. 1, 2, 3, and relax. Again, 1, 2, 3, relax, and then once more. Perfect. Okay, and then we can do the face. Think about all the drainage from your face, your jaw, all of this area. It all has to come down through the neck. So now we can do facial pumps. Okay. Let's say your patient has swelling anywhere in the face. An active lymphatic pumping exercise we can do is kind of like a face squeeze. So I want you to scrunch your face up as much as you can. 1, 2, 3, and then relax. Let it go. Scrunch it up. 1, 2, 3, and relax. Scrunch it up again. 1, 2, 3, and let it go. 2 more times. Scrunch it up. 1, 2, 3, and let it go. And one last time. Good. Perfect. So what we did is we started in the chest, we did the ribs, we did the shoulder rolls, and then we did the front of the neck, and we ended in the face, okay? So we work proximal to distal. Distal is the face. And I would typically do 3 to 5 reps of each one. Now that we're in the face, we work again. So you do double in the face. So if you did 3 or 5, you do another set of 3 or 5, right? And then once you finish doing that, then you do your upper cervical flexion pumps again, okay? And what do you do after that? You do the lower cervical flexion pumps, right? We work proximal, now distal. And what do we do after that? Shoulder rolls, right? We do everything in opposite sequence. What do you do after that? The anterior arm lift, right? You can add respiration with this. And then what do we do at the end? We do the spinal roll down. So if you remember, so the key thing when you do these exercises is you need to understand the pathways. And we know that it all drains towards the heart. So you're usually starting, with the slumping, the arm lifts, shoulder rolls in all of them. And then from there, you branch out, whether you're going into the head and neck or into your arms or legs or anywhere else. You're going to follow that sequence. Okay? And you work proximal to distal and then distal proximal. Now, I'm not going to go through all these in detail, but I did put them in there for you. I mean, this is obviously good for athletes we talked about, car accidents, falls, sports injuries, post-surgical. This is very important. I remember now I had this lady who had a herniation of her medulla oblongata and she had surgery and they had to open her up back here. Well, she called me in tears. She goes, "Oh my God, I think my head's going to explode." And I'm not going to touch that area because it's all acute surgery. But what I noticed that all this area here was all locked down. So all I did is I had her doing some gentle flexion extension, breathing like this, and doing this. That's all. And I just did some gentle massage like this coming down. Once I did that, when I worked with her, she was like probably about 50% better, but by the next day, 80% better. And I had her continue to do that. I had a guy who had severe swelling in his legs and it was all red and stuff was oozing out of the skin. You're not going to touch that, but you know that the legs are all going to drain up this way. All my exercises were all up in here because things move from a high pressure to a low pressure. Okay. So this just mentions all the different people you can use it on. Okay. People with trauma, you know, edema, sports, injuries, all sorts of things you can read. You can read all that. Now, contraindications. This is like the guy I had with the leg, the stuff oozing. If you see something like that, you're not going to work that area. You're not going to touch that area, but you can work above it. If you know that that arm is going to go to the axilla and then it's going to go to the subclavian and all this area here, you can work that area. And you know it's going to the heart, you can work on that. Okay. If somebody has, you can see the size difference there. So if somebody has an embolism, right, a venous obstruction, you're not going to work on that, but you can work above it. Okay, you can work above that area. If somebody has congestive heart failure, it doesn't mean you can't do this, but you're not going to do long treatments. You're going to do maybe 10, 15 minutes, real small amounts, but that's actually good for this area. My dad had congestive heart failure, so we did a lot of this with him. If you have someone who has a broken arm or a foot, severe sprain, you're not going to touch that area. You're not even going to do exercise with it, but you can work above it just to help that area clear out, you know, the waste products from that area so it can heal much quicker. Okay. If you have renal failure, acute enuresis, any of those things, remember that all of this, when I teach these classes live, remember that all of this is going to be, all the excess fluid is going to be eliminated through your urine typically, right? A big amount. People always wonder about malignancy. My wife had breast cancer. She had a double mastectomy. We use this with her, no problem. I have lots of cancer patients I'm working on now. We're not using this to treat cancer. We're using this to balance the body. And I do orthopedic stuff. I do my total body balancing. I do all my other techniques orthopedically to keep them in balance. And in Europe, they use this quite a bit. Foley talks about this with cancer patients. People always fear that it's going to metastasize. Now, if someone has lung cancer, you're not going to actively work over that lung, but you can still do these exercises and help to promote circulation. Let's see, we talked about that. And other things, if someone has hyperthyroidism or a stenosis here, you're not going to do mainly a lot of, you know, the technique is very gentle, but you know, when you have new students, they're very aggressive in this area, they do it too much, that could aggravate. Or if someone's had a stroke in the past or a thrombus, again, you want to kind of avoid those areas. Other ones, pregnancy, you're going to avoid deep abdominal work, dysmenorrhea, diverticulitis, that's all obvious stuff. Sometimes when you have a lot of allergies and they're being activated, they recommend not to do it. When you get someone who's elderly, and if you're doing this more manually, be very, very gentle. You can do this very lightly. Some people tend to be too heavy-handed and you can get a lot of bruising. If someone has low blood pressure, you just have to make sure you're supporting them and be beside them, especially from lying to sit or if they're doing these exercises. You know, if someone has unexplained pain or weight loss, again, you know this, refer them to a physician. So at DAI, our mission is to educate health practitioners like yourself how to make better clinical decisions. This is done by knowing where to treat, either systemically or specifically. I've given you this, I've given you the total body screening examination sheet, the video, you got the QR code for that, so you can learn that. And also knowing what to treat. We talked about the specific evaluation that tells you whether it's muscle or it's joint or it's fascia or it's fluid, right? And then knowing how to treat. We showed you some exercises tonight, right? So you could start to work with this, okay? Now, if you want more information or you want to contact me, you might want to take a picture of this. It shows our website. We have a brand new one, the drkerryd.com. It's probably like 80% done. I've still got to work on that in my spare time. And that's it. Okay. So I wanted to thank Danelle and Biotome, and I enjoy doing these series. And hopefully you got something out of this. I threw a lot at you, but you'll get, Danelle will tell you, you'll get a link for this so you can watch it again. I wanted to try to give you as much information. Remember, you're going to have a study guide with all of this in there. So everything, and I gave you an article. I put an article together for you as well. So Danelle's got lots of goodies to send your way.
That's true. And if I can figure out how to unspotlight you, and maybe I have,
Yeah,
um,
you're spotlighted.
I uh, I don't see it showing up, Kerry. My technical challenges. Um, we do have some chat questions that came in, and you answered one of them. Cecile was asking about your Instagram. So that information, for those of you that aren't familiar with EduTalks and this is your first time attending, the day after an EduTalk, we send out a follow-up email that includes a recording link. It includes a presenter handout, and it includes the presenter contact information, as well as Kerry showed you a slide with a QR code in it for a free class, and that will be in the follow-up as well. I'd like to mention, and I'll put this link in the follow-up email tomorrow. Kerry's last talk was on systemic lymphatic balancing. That was November 18th, 2025. And as all EduTalks are posted on biotone.com under the EduTalk tab in the archive library, if you go there, just scroll through till you get to November 18th, and you can watch Kerry's last EduTalk there.
Yeah, I would watch.
Let's
I would watch that systemic one as well. If you haven't, that would make this make a little bit more sense. Yeah.
right, right, and there are videos in that as well, and Kerry covers a lot of the information, not only in that talk, but in previous talks that he's done. I can see where it all kind of ties in together, Kerry. Um, let's see. Liana is asking for the pumping exercises, are there suggested rep count minimums?
Yeah, I mean, if I'm dealing with someone who's elderly, I'll probably just do three. But someone who is a little bit more fit, I'll go up to five. Remember, they're doing them proximally all the way distally, but then they got to come back down again. So it's a lot of repetitions. So if at the beginning, if it's somebody new, probably three of each one. And how many times a day? I believe, some people just do exercise in the morning. If you have a problem, I believe in spreading it out through the day. So I might do this 3 or 4 times a day if it's a serious problem. If not, definitely at least twice a day, and usually three.
All right. And Thomas started his chat with this was great. Question: have you found the terminitis? How do you say that?
Oh, he's talking about the drainage into
Drain.
the
How do you
subclavian
pronounce
vein,
that?
terminalis.
Terminaeus drain as effectively without manually stimulating them before the pumping exercises. Also, any quick stretches that get axillary terminitis, uh, usus pumping.
So
I have
I'll
to go
answer.
back to
I
school.
think I know. So the question is, when I do these live, and I'm going to be doing Um, I'm going to a bunch of seminars. I think I'm doing the Florida State Massage Therapy Convention in July, but I'm also doing the Canadian Massage Therapy thing in Burlington, I think in May, and I'll be doing a lot of these things. And when you're live in person, what I do is I always try to pick someone who has a lot of swelling and they have a lot of problems and I don't touch them at all. I don't do any manual thing. I do it all through exercise. So, and we show you huge differences just if you do them in the correct order, the correct number of weights. So no, you don't need to do that. Now, if you have someone who is very difficult, I would do both. In my office, a lot of times I'm going to teach the patient the exercises first so we can both see the changes because if they don't see the changes, they're not going to do it. If they can feel, oh yeah, I'm really stiff, this arm's tight or my leg's tight, and then I get them to go through it all and they go, oh wow, this feels so much better. Great, now they're going to do it. Now I'm going to manually work with them and then I'm going to have them do the exercises again. So typically I have them exercise, I'll do work with them manually, but I have them exercise again and then throughout the day.
Now, how do you treat someone whose mind is blown?
Whose mind
Laura
is
is
blown.
saying she loved all this information and her mind is blown. Um,
I would say it's a lot of information and I was a student myself. I still am a student, and I wanted to be complete in this. I wanted to give you a lot of good information, and it's okay to have your mind blown. What does that mean? It means you've learned something, or you're about to learn something. It's frustrating. We all, I hate it when I watch something. I go, I don't know that yet, but then I get excited. So what I would do is watch it again and again. And I've given you haven't seen it yet. She's going to send it tomorrow, but you'll get an article from me. I put together a really detailed study guide that goes over the exercises, goes over the anatomy, all that stuff. So you're just reading and reading, and you may want to take a longer course later. Go on ChatGPT, go on YouTube. Just start to spark interest. In that.
agree. And Janice is asking the amount of pressure with this technique.
When you do it manually, everything I do is very gentle. So when people say how much pressure, I always say enough because I usually line up, 10 people and I put my hand, I'm sinking down till I feel the first sign of resistance, the bogginess. Some people will be very superficial. Other people I may need to sink in much deeper, but it's all very gentle. Even though I'm deep, it's a very gentle force. I don't like to give grams, but the lightest you'd be is maybe like 5 to 10 grams, somewhere around there. But it's very gentle. But each time, remember, we have a superficial and a deep collector lane. So a lot of people are working that superficial, but there's also the deep. But you don't blow through the first collector lane. You got to work that out and then go a little bit deeper. But I find doing the exercises helps to get a good pump through the muscles, the deeper circulation.
All right. Many, many, many thank yous, thank yous, excellent information, great presentation, et cetera, et cetera. I have a question, which, um, wait a second. Kimberly is saying, aha moment, don't rush past the clavicle to the axilla. Thank you.
Okay.
All right. I was at the AMTA School Summit recently, and one of the vendors there had the vibration plates
hmm
that you would stand on. How does that tie into the lymph system and treatments? Because it kind of shakes your whole body.
hmm I would say that, and I think that you have to do a study. I had a vibration machine here, so I have done the study. I've evaluated someone and I put them on that. Now, if you have specific lesions, if you have restrictions in your diaphragm, if your chest is restricted, you could stand on that thing all day. You're not going to get better flow. But if you were to open somebody up and then put them on it, right, or a chi machine or something like that, then I think you would have some added benefit. Okay. But it's like when people get neck traction. People go, do you believe in that? I go, oh, at the right time. I like to treat my patients and loosen up the muscles and the fascia and the joints, then do the traction. Because if you just had somebody do traction, there's all that tension there, where's it going to go? How's it going to pull apart? So every modality works. Those things do work, But I think it all comes back to what I said earlier. Evaluate. What am I dealing with? Right? Is this person ready for it? And then administer, reevaluate. Were you successful? Test it out. But if somebody has a lot of restrictions, I would say work on them first. And remember that when you're standing on those things and you're jiggling, it's not doing things in the right order, is it? Remember we
No.
said proximal, distal, distal, proximal? No, it's not doing that at all. So I would do it more as an adjunct after I treat it. But I'd want to measure it for that person afterwards and see, did it work?
Well, thank you. And again, everyone, thank you for joining us. Tomorrow, please look for the follow-up email midday. If you do not see it in your inbox, please check junk or spam folders. Often the follow-up emails go there. There will be handouts attached to it, as Kerry has mentioned and supplied us with to share with you. The QR code will be included in the follow-up as well, with more of a description on the free 1 hour video. And all the contact information will be there. Again, the systemic lymphatic balancing was presented on November 18th, and again, in the archive library on biotone.com under the EduTalk tab. Thank you so much, everyone. And thank you, Kerry, for another very informative and excellent EduTalk. I really appreciate learning from you, and I'm not even a therapist. So I
Thank
always
you,
learn.
Barral. Thanks for having me.
Okay.
And hopefully we'll see you guys at some conference. I'll be at the FSMTA in July. Hopefully, you going to be there?
I'm not sure. Where is it? What part of Florida?
It's in Orlando. It's in Orlando.
Oh, okay. I'll
Yep.
keep my eye on it. That would be great. I'd love to see you again.
All right. You take care.
All
Thanks for
right.
having me.
Thank you,
Bye,
everyone.
everybody. Take care.
Be safe.